Oh, we're running out of tape. Hi, baby. Yeah.
You've just brought home your baby. You feel bliss, joy, and unconditional love. Well, not necessarily. I'm Shay Pausa. Today on She Knows, we're going to talk about a secret that so many women are ashamed and embarrassed to talk about: postpartum depression. Gwyneth Paltrow said she suffered from postpartum depression after the birth of her second child, son Moses. And she's not alone. Celebrity moms Brooke Shields, Courtney Cox, Lisa Marie Presley, and the forever smiling Marie Osmond have admitted to suffering from the disorder. Dr. Shoshana Bennett, author of Postpartum for Dummies, first clears up the difference between the baby blues, which 80% of all of us experience, and postpartum depression disorders.
There are a few days of ups and downs and feeling vulnerable and dependent. If it continues past the 2 weeks, we now call it postpartum depression, even if it's mild.
Melissa McGarry, a mom of two, tears up as she describes her nightmare with postpartum depression.
With postpartum, you have this battle between your rational brain and your psychotic. Being fully conscious, holding my daughter and seeing myself put her in the oven, or seeing myself stab her.
Dr. Bennett says this was most likely postpartum OCD.
Postpartum obsessive compulsive disorder can be that's a pretty scary one. I mean, they all feel horrible, but postpartum OCD there can be a component of postpartum OCD where the mom is having very scary thoughts of harming her child.
Melissa, like many moms, knew she could not hurt her children. Unfortunately, left untreated, the alternatives are not much better.
My rational side knew I couldn't hurt the kids, so then it was, how do I hurt myself to stop this? And the trying to figure out, to calculate how hard do I have to hit the tree so that I die and my kids are okay. However many pills I take, however I decide to slit my wrist, whatever, so that they don't wake up and have to be hungry or whatever until somebody would come home and find me.
Fortunately, Melissa got help.
Barged into my OB's office and I was just sobbing, and I just said, I don't know what to do. I'm going to die. I'm going to do something. I don't know what I'm going to do.
With medication and therapy, things turned around. I asked her how this had affected her relationship with her husband and why she had kept it a secret.
How do you look someone in the eye who is the father, who is your husband, and tell him these kinds of thoughts? Not while it's happening. Because then there's the fear of, they're going to take my kids away from me. But should they?
But once everything is in the open, everyone is safer and happier.
I'm a horrible mother. I'm a horrible mother to even think this. And I think making that separation of, this is not about me as a mother, this is about something physiological and biological that's happening.
The more matter-of-factly we discuss postpartum depression and related mood disorders, the easier it is. I mean, the defensiveness melts away. That's it. And what happens is that there isn't something horrible or inadequate about me.
So what should a new mom do? If your blues go beyond 2 weeks, seek professional help. Call your doctor. Tell a friend, your spouse, your mom, anyone. Accept help. Get rest, and by all means, give up the superwoman notion. She doesn't exist. And this advice comes from a woman who knows.
What I learned is that being a good mother is being true to yourself and taking care of yourself first, because then you have more to give to your children.
Thanks to Melissa for sharing her story, and to Dr. Bennett for sharing such great information. For more, be sure to click on the links below. I'm Shay Pausa. I'll see you next time.
Thanks for watching She Knows TV. Look for more She Knows TV at sheknows.com.